And with that, I would like to open a work session on House Bill 2201, and I would like to hear first from the Speaker. Thank you, Mr. Speaker.
Thank you, Mr. Chair and members of the committee. Representative Jeff Merkley from District 47. Speaker of the House, I've come to talk to you today because nothing is more important that we will consider this session than this plan for insuring the children of the state. It will affect more than 100,000 children, and that affordable, accessible health care will have a profound impact not only on the children but on their families. If we were to line up those children, that line would stretch 40 miles. So I'd like to ask you all to envision children lined up from here to Portland, roughly that 40-mile distance. I have recalled people coming into my office during their 2001, 2002 turn down who had a specific health care problem, and they were concerned about losing health insurance under OHP standard. And they'd have a specific story about the challenges that they would face. But this is not a small number of people, nor was that for a matter, but this is a huge line of Oregon's children and Oregon's families waiting on the Oregon legislature to figure out a way to provide affordable, accessible health care. I think the sentiment that this is a very important stepping stone is widely shared on both sides of the aisle. And that led last week to more than 10 hours of negotiation involving the Republican House leadership and the Democratic House leadership. And I want to praise those who participated because they came and they brought their ideas and they brought their hearts and they brought their minds and they applied them to seeing if we could have a plan that we could put forward today that would bridge the differences between the individual perspectives and the caucus perspectives on how to take this bill forward. I would, of course, love to be sitting here today with the Democratic leader of the House and the Republican leader of the House saying that we succeeded. And we may not have succeeded in being able to put both caucuses squarely behind a plan. But what did come out of those discussions were many good ideas for improving the plan. And while we continue to work on bridging the differences in perspectives, we need to take those best ideas, put them into this plan, and take this plan forward. So I do thank the Republican leadership and Democratic leadership who participated so wholeheartedly in putting those ideas forward. What I'm presenting to you today is a group of amendments. I believe that you will have a sheet that will say proposed amendments if it's been passed out yet. And it will list 7 amendments. Do you have those, Mr. Chair?
I do, and I'm wondering if other members do.
Okay.
Yeah, I think we do, Mr. Speaker.
I'm only going to speak to 5 of these amendments. And the amendments number 6 and 7 are technical amendments best left in the hands of the staff and chair who were involved in the preparation, or those who were involved in the preparation. But the other 5 involve ways to improve this plan. The first is to change the rate on the federal poverty level to 300% from 350%. This is the rate that's been widely adopted by other states in the nation. It is also the highest level at which we receive federal match. And in that sense, it maximizes the federal investment that we will bring to the state of Oregon. It also goes much further in bringing more children into the plan than we would be bringing in if we were at a rate of 200 or 250%, other ideas that have been put forward. The second amendment addresses residency, and it provides evidence of Oregon residency for all applicants. This was a response to the concern of ghost applicants who might apply from other states but not truly be residents of the state, so people would have to show that they do in fact live here, and would also require 6 months of legal residency except when qualified under federal law. And this is a response to the desire to assist people in the state but not say to the world, move to Oregon and we will take care of every health care need. So the goal is to serve people who move to the state but not incentivize people to move to the state. The Third Amendment comes out of a conversation about how to make health care accessible. Even if someone has insurance, you need certain things to take advantage of that insurance. You need help knowing when you need to go to a doctor, and therefore we'll be setting up a statewide nursing hotline so that every family could call up and say, here is the problem I'm experiencing. Is this a serious problem? Should I go to emergency care? Should I go to urgent care? And second of all, the second line is an access line, and that is designed to answer a different question, which is, who can I go to? Now, in practice, whether these might be combined, I don't know. Those are details left to others who would implement the program. But the point is, families have to know where they can get care, and they need to help in knowing when they need to go get care in situations that they are experiencing with their children. The Fourth Amendment requires fully capitated insurance programs under Healthy Kids to reimburse federally qualified health centers, school-based health centers, and safety net clinics for care to insured children. And this came out of the conversation that these types of clinics serve children all over the state, many of them scattered through areas far from urban centers, and are a very, very helpful way of providing health care. And that, as one member put it, we're really not about the goal of providing insurance. Insurance is a mechanism. We are about the goal of providing health care. And these clinics provide direct health care and should be strengthened under this plan when they provide assistance to our children. And the Fifth Amendment addresses Tobacco Use Reduction Act funding and says that it would be spent on the proven best practices for reducing child and teen smoking. I think many of us recognize that there's much more bang for the buck on the healthcare dollar on the prevention end than on the treatment end. Much cheaper to educate a child about the dangers of smoking than to operate on heart disease or lung disease later in life. So not only does this type of program impact quality of life one lives, but it also affects the costs imposed on the healthcare system. It was apparent that if these additional funds are to be spent on prevention, we want to make sure they're spent in a way that maximizes the impact on the children, therefore utilize the studies that have been done about how to make those dollars be used effectively. So those are the 5 ideas for strengthening this plan, for giving families a handle on the healthcare system, both as to when they need help and where to find it. And I appreciate the chance to come and present these ideas, these amendments to your committee.